Did you know that almost half of transfers to the hospital could be avoided? We're here to help you understand why these transfers are made and how you can be involved in the decision. This question comes up if your condition changes. Go to the hospital or stay here. Now, this change could be a fever, shortness of breath, pain, injury from a fall, or a number of other things. If this happens, your provider has to explain to you the change and the decisions that need to be made to provide you with the best possible treatment. Why think about this now? Well, it can be quite difficult to weigh the pros and cons of a transfer to the hospital when you are already ill, and it's not easy to make a decision in the middle of a crisis. This information we're about to give you is so that, should it ever happen, you can make an informed decision when it arises. If it's not an emergency, the nurse can assess your condition, ask you what happened, how you feel, where it hurts, listen to your heart and lungs, take your temperature, blood pressure, oxygen level, test your blood and urine.
Did you know that many of your tests and treatments can be provided here in the facility by our skilled staff? These could be medications, x-rays and blood tests, oxygen, wound care, comfort care, pain relief, bed rest, intravenous fluids in some facilities, and physical, speech, or occupational therapy. We can also check on you and report to your doctor or medical provider. And you can ask your nurse, doctor, or other medical provider what else can be done for you here. These are some of the main reasons someone might prefer to be treated here.
Of course, we can't do everything. Hospitals can provide more complex tests and treatment, including heart monitoring, body scans, intensive care, blood transfusion, and surgery. These are the kinds of reasons you might have to be treated in the hospital, and you should carefully consider all of these factors when you're making your decision. Being transferred to the hospital can be stressful. You're likely to have to explain your concerns all over again to new nurses and doctors. You're at a greater risk for skin breakdown, exposure to infection, and maybe even falling in an unfamiliar place. So you may feel more comfortable staying here and being cared for by the staff who knows you.
I know. Last year, they sent me to hospital just for 3-4 days for intravenous medication. I was supposed to be there just 3-4 days, but I developed pneumonia and I had to stay much longer. Since then, I really don't like to go to the hospital for this sort of thing. I like to be treated in the place where I live.
The main thing is that we want you to be involved in that decision. You have the right to know what's happening to you, what treatments are available, the risks and benefits of these treatments, how decisions about your care are being made, and how you are involved in making them. So you may want to talk to people about your choices. Your nurses, doctors, or other medical providers, of course, but also social workers, spiritual advisor, family members, close friends, or caregivers. These are very personal decisions, and it's up to you who you want to talk to and whose opinions you respect. You can make your preferences known by talking with people that I've mentioned, putting your wishes in writing, and telling people where those documents can be found. You can also complete advance directive documents, including a power of attorney for your healthcare, a healthcare proxy, where you name someone to make healthcare decisions for you if at any time you can't. There's a living will, which states your preferences for end-of-life care. And there are orders for a DNR, do not resuscitate, or DNH, do not hospitalize, if you prefer, should that time come. There are also physician orders for life-sustaining treatment, PULSed, or similar form that is acceptable in your state.
So what can we do to help you with this process? If you still have questions, please ask your nurse, social worker, doctor, nurse practitioner, or physician assistant to talk with you. They can take you through the guide and any questions you might have. They may recommend others talk with you as well. And the guide has an extensive frequently asked questions section, which goes over many of the questions others have had before. It also has lots of comments other people have made about this issue. So remember, It's your care, your decision, and we want you to have the best care that you feel is right for you.
Mr. Jean, I'm Goldie Cohen. I'm the social worker here at the nursing home. How are you today?
Thank you. I'm doing good. So, why would the doctor consider sending my mom to a hospital?
If your mother has an injury or a serious change in condition, her medical provider will make that decision to send her to the hospital.
So, what exactly do you mean by medical provider?
A medical provider can be the doctor, an MD, which is a medical doctor, DO, which is a doctor of osteopathy, a nurse practitioner, or a physician's assistant.
So, when would staying here be the best choice for her?
If we can treat her here, that would be the best choice. If she has a condition that can be treated here.
And what kind of care can you provide here?
Well, it does vary from facility to facility, but we can do most injections. We can give medication by mouth. We can do intravenous, but not blood transfusions. We can do general lab testing, x-rays, and we can monitor your mother's condition very well here.
Are there any other reason I would want her to be cared for here?
Well, your mother is comfortable here. The staff knows her. She might be very, very confused, and it might be stressful to take her out of the surroundings and put her into an environment that she's not familiar with.
So what is a hospitalist?
A hospitalist is a doctor that oversees the care of patients in a hospital. In many hospitals, the primary care doctor will not be overseeing your mom's care. It will be a hospitalist.
We'll make the final decision on whether to send her to the hospital or stay here.
Your doctor, your nurse practitioner, or physician's assistant will consult with you and your mother before a decision is made.
So how much say do I have in this decision?
Well, that's up to you and the family. Some folks want to be very, very involved in the decision making. In other cases, they don't really want to make that decision, so that will be entirely up to you. Keep in mind that if it is advised that your mother be sent to the hospital and for some reason you decide that you don't want her to be sent there, they may ask you to sign a form stating that you've made that decision.
What happens if it's an emergency?
In an emergency, we're going to call the EMTs, and they're going to come and they're going to deliver on-the-spot treatment to your mother, and then, if necessary, they will transport her to the closest hospital.
Can we request a certain hospital?
You can, but in an emergency, the EMTs will take her to the closest hospital that can provide the care that she needs. In the event that it is not an emergency, they can take her to the hospital of your choice. If it isn't an emergency and the hospital is close by, they may be able to take her there.
Will we know where she is? Will she know what's happening to her?
Sometimes during a 911 emergency, there isn't time to call the family, but your mother will be able to ask that you be contacted as soon as possible, and the nurses and the healthcare providers will keep you informed of what is happening.
Will she still be able to get physical and occupational therapy when she's in the hospital?
That depends on how sick she is. If therapy is discontinued, when she is ready, they will restart the therapy for her.
Will she come back here after she's discharged from the hospital?
In most cases, yes, but in certain circumstances, going to a different rehabilitation center or nursing home, or possibly even going home, might be the best choice for her.
But will you hold her room for her while she's in the hospital?
Most of the time, a nursing home will hold the room for several days. These policies vary from place to place, but you should ask somebody at the facility to make sure what their policies are.
What happens to her personal effects if she's transferred to the hospital?
Oh, we'll keep them safely put away for her in storage.
So why are we talking about this now?
Well, it's difficult to consider options and your personal preferences when you're in the middle of a healthcare crisis, such as your mother having to go back to the hospital. It's best You may be upset and worried. Your mother may be upset. And it's best that you talk about your preferences beforehand.
So why is this decision so important?
There are some risks and discomforts associated with being sent to the hospital. The transfer itself, it's a new environment. It can be, it's new routine. It's staff that's not familiar with your mother. There's the risk of falls and infections. And again, the cost of a transfer and the hospitalization itself can be very, very expensive. Insurance may not necessarily cover the transfer and the hospitalization. So you may want to ask and get this information so that you understand all of the costs that are associated with this transfer to the hospital.
Well, thank you very much for all the information. And
I hope that I've been helpful for you.
thank you. It was a pleasure. What exactly is the difference between hospice care and palliative care?
The type of care is similar, but hospice care is meant for patients who generally have about 6 months or less to live. Palliative care can go on for months or years even, and it's more considered comfort care.
So what do you mean by comfort care?
Comfort care focuses on symptoms management. It's concerned with easing the effects of the treatment or the condition itself. Fatigue, nausea, diarrhea, pain, breathing problems, to keep the patient comfortable, more importantly than actually treating the actual disease. Palliative care teams help people cope with their illnesses. We offer practical solutions, emotional support, and spiritual care.
What are advance directives? Should she have them?
Advance directives are documents that tell the family, the medical provider, hospital, skilled facility, or the rehab staff what kind of care that she wants to receive in the event that she is too ill to make that decision and unable to be involved at that time. Your mother can say that she doesn't want certain treatments like CPR, which is resuscitation, if her heart should stop, or to be put on a breathing machine if she cannot breathe on her own. She can also state she wants all the treatment available if it comes to that. She can also designate someone like yourself or a sibling to make decisions for her if she can't make those decisions for herself when the time comes.
If she does have advance directives, will her wishes be honored?
To make sure that her wishes are honored, it's very important to have them reviewed. Review them with her healthcare provider, with the staff, and to make sure that a copy is on her chart at the hospital and also at the nursing home. It's a good idea for you and the medical care provider to have copies of the advance directives ahead of time, before a crisis occurs.
Once she made her wishes known in the advance directive, can she change her mind?
Yes, she can change her mind and the advance directives at any time.
So what would happen if my mom couldn't express her wishes? Say if she had a stroke or something like that?
A resident's wishes always need to be respected. There are alternate forms of communication that you could consider. If your mother has an advance directive that appoints someone as the healthcare proxy, that person may make decisions for her based on what she would want if she was able to express her wishes, or she can complete advance directives to let everyone know what her wishes are.
If she couldn't express her wishes, should we still tell her what's happening?
Yes, absolutely. Every resident has the right to know what is happening and should be treated as if she understands the situation. Some people may become anxious or frightened if they're moved to an unfamiliar place without an explanation. Be sure to use simple, direct words, such as "you are sick," Your doctor thinks that you need to go to the hospital. A quiet voice and a calm manner when explaining the situation to her.
So how can I be involved in that decision?
You may need to complete some legal forms to do this. We can give you some detailed information about how this is done. It would be best to do this before a question about treatment or hospital transfer comes up, as well as while your mother can still express her wishes. That's the most important thing of all.
Well, thank you very much.
Thank you.